Hello and good afternoon from Miami Beach, Florida. Today we have a huge privilege and opportunity to talk with one of the greatest internationally known experts in the field of cord blood transplantations, Professor Dr. Joanne Kurtzberg. Professor is also the head of the Cord Blood Association and a professor at the Duke University. My name is Dr. Christian. I'm the medical director of the BioSave Foundation, and my colleague and support, Ms. Dijana Sejdinovic, medical director from BioSave Adriatics, Bosnia and Herzegovina. Professor, thank you very much for your time and for this little quick chat. So, after 2 years of Cord Blood Connect online, we finally see each other here alive in person in Miami. So, can you briefly summarize the main messages and point of this Congress and tell us just what makes this year so special?
Well, first of all, I think we're all very happy to be able to be together again in person.
Yeah.
Because the interactions in person are always better than seeing each other online.
Yeah, on the camera.
I think for the meeting, there's been a lot of great content. And what's most exciting to me is that the uses of cord blood are expanding, and that clinically it's being tested in more diseases, and then in the laboratory it's being used as source material for manufacturing of other kinds of cells that can also help patients with unmet medical needs.
Yes. So,
I would like to just address a little bit and this coronavirus pandemic that actually reminded us all how much prevention is more important in practice than in theory. And after the 3 years, we have results in therapy for the COVID patients, and also we heard there was a stem cell transplantation in the case of HIV infection. So we just wanted to ask you, do you believe that the cord blood can be a potential weapon in the fight against the different viral infections, and that is it possible that we continue to work in that field to just, let's say, fight against this global threat in health?
Sure. So first of all, for HIV, cord blood transplant from CCR5 negative donors, which you can identify in cord blood units, is a way to transplant them either because they've developed malignancy or such poor immune function that they need a transplant that can prevent reinfection with HIV. So it can be a cure for HIV. But for other types of infection, particularly coronavirus, there was some very interesting data presented here, both from unmodified cord blood or NK cells derived from cord blood, showing that they may be able to fight COVID-19, particularly in patients with pneumonia. And wasn't presented here, but mesenchymal stromal cells that are isolated from cord tissue also have been shown to help patients with COVID ARDS. So it's early, these are early phase trials, but yes, there is a reason to pursue that research.
I mean, every day and using these kinds of events, we can see how much this area of medicine expands in every day. For me as a geneticist, it's really interesting to hear about using actually cord blood in gene therapy and cell therapy, and I was really happy to hear those lectures today. So I wanted to ask you also, what can we expect in that kind of area, and is that actually the future that we are seeing?
So I do think that there will be a future for cord blood used, as we say, as a starting material to produce immune effector cells like CAR T cells, cytotoxic T cells, NK cells, CAR NK cells, which can be used against both cancer and infection, and which from cord blood would be what we say allogeneic, or in a patient with cancer who might have stored their own cord blood can be autologous but healthy because it comes before they develop cancer. So I do think we'll see that happen. But I also think there are other types of cell products being derived from cord blood now that can help people with neurologic diseases. And I think in gene therapy, cord blood cells are easier to transfect. So in the allogeneic setting, you'll get more efficient effect of the gene therapy and longer lasting active cells from the gene therapy from cord blood compared to adult bone marrow or adult mobilized blood.
I'm really looking forward to see what will happen next in that area and to be in touch with all of your colleagues. Christian wanted to...
Yeah, I'm pretty excited to hear some news in Warsaw in a month and a half, right? You'll be joining us in Warsaw on the Congress. I
think virtually.
Virtually,
yes.
Of course.
But yes, I will be there.
It's good to see you in person or virtually.
Yeah.
So, just a quick question about our BioSafe Foundation, because I get a lot of requests and interest from parents from the Balkans that parents who has children with autism and development disorders and the diabetes type 1. Those are the most
common
inquiries. So where are we now and how far we progressed in the field in treating those conditions? We saw a lot of good lectures today. So what about the diabetes type 1? What about the other development disorders?
Yeah, so the research using cord blood or cord tissue-derived cells in those disorders is still research.
Yeah.
There's some early hints of promising results, but it's not ready for a clinical therapy. There still needs to be more phase 2 and phase 3 clinical trials to really understand if it works and in whom it works.
Yeah.
And for type 1 diabetes, autologous cord blood may be helpful in giving more time for the pancreas to recover, but you still have to treat the underlying disease first. And then in autism, there are some exciting results, particularly for children without intellectual disability.
Yeah.
But again, this is phase 2, and it would have to be confirmed in a phase 3 study before it can be, anyone can be sure that it's an effective therapy.
We all have to have hope,
Yeah.
and that is the most important thing for the parents, for the children, for the researchers. That's the energy that pushes us forward to make new. To make new possibilities for everyone.
And also, before we say bye, I will just I want to talk with you about one topic that is really important for us. It has been 35 years since the first umbilical cord blood transplant. It was done over 40,000 transplants so far, but we in Balkans still find ourselves surrounded by skepticism regarding stem cell therapy and cord blood transplants, especially with physicians, especially with gynecologists who are in the first line when in talking with pregnant women. So we wanted to ask you, do you have any advice with us how to fight against it, and what can we do just to resolve that kind of problem, even though we are always trying to give the information to general public and to all these things that we learn here, to give it back to them actually.
Yeah, so it's hard because I don't think you need to save every single cord that comes from every single baby who's born. And I think we've shown for transplant that using donor cord blood is the most effective approach, because the person themselves who has cancer, for example, or a genetic disease shouldn't get their own cord blood because it has the same disease. But for some of these newer applications, like cerebral palsy, or maybe stroke, or maybe autism, or maybe immune effector therapy for cancer, we're still learning whether you need your own or a donor is okay, or both will work. But I would say to the OBGYNs that this is a very valuable substance, and the best thing you can do is save it and have it used, and whether that's donating to a public bank or keeping for the family themselves or using for research, it's really a very special, precious material, and throwing it away is a real shame and shouldn't occur.
Definitely. Thank you very much for your time.
You're welcome.
We're looking forward to seeing you again and for the next CordBlood Connect.
Thank you.
Yeah.
Thank you.
All right.
See you next year in Miami.
Okay, yes. All right.
Thank you for your time,
Thank you very
and
much,
we
Professor.
hope that it wasn't too long, and
no,
that
it's
was
fine.